X-rays. Okay, so it's that all-important moment of the office visit in which you have your X-rays, because this patient, if they've done any research or talking to their friends, is convinced they have a heel spur. It's probably the only thing the general public knows about heel pain is a heel spur. So they're all convinced they have a spur, and they may have one, okay? But that's where the X-ray is going to come into play. I'm going to go through several examples of what to look for on the X-ray, some subtle signs, some obvious signs, but the X-ray is critical that there's a weight-bearing X-ray. We want to see what the position of the foot looks like in a weight-bearing structure, also how the joints are functioning. We want to look for, is there a subtalar coalition? Is there a falling mid-tarsal arch? Does it coordinate with excess pronation? Fracture, tumor, all kinds of things that we're going to look for in X-ray. I'm going to run through a bunch of examples of some things that you'll look for in standard and also non-standard. As again, I want to be all comprehensive in this. My first quick example is if there is a child or young teen with heel pain, very, very likely there's no chance they have plantar fasciitis, but they have Seaver's disease or an inflammation of the growth plate. You can see tibial growth plate still open here, the posterior calcaneal growth plate open, and an inflammation of that being Seaver's disease, not plantar fasciitis. So I've got lots more examples that we'll run through now. Here is a closer look at this child with Seaver's disease. Again, here's the tibial growth plate, which is open. Here's the posterior calcaneal growth plate here, and very common where the Achilles tendon comes and attaches, it's pulling on the posterior calcaneus and creates an inflamed growth plate here. Usually a child that's growing quickly or in sports or gaining weight, and just they're doing an adult level type sport, and a little kitty growth plate can't handle that type of stress. Clearly no spur formation on the bottom or the back. This is all about the growth plate and not plantar fasciitis, but certainly your number one differential in any child with heel pain. So I've got lots more examples that we'll run through now. This patient is 80 years old and she presented with heel pain off and on for many years. Most notable for her here is this very large plantar calcaneal exostosis here. This had some trauma in the past where the spur has broken off and calcified even further. She will end up with a massive plantar calcaneal exostosis. Also notable, she does have prominent bone on the plantar calcaneus here and a weaker fat pad here. There's not a lot of space between here and the bottom of the plate. She'll need accommodation to support this and take pressure off here. Again, heel cushion or even a horseshoe pad to remove that pressure. Posterior calcaneal exostosis as well, also leading to and explaining part of the tight Achilles tendon, chronic pulling here, tight plantar fascia pulling here at the insertion, so much so that it has broken and recalcified. The arch, as you may expect, has a decrease in the mid-tarsal arch here, also adding to the fact that, as you would guess, is going to need some orthotic arch support. Here's a good example of a relatively normal X-ray where there is no calcification here, no plantar calcaneal exostosis. The posterior calcaneal exostosis is not present either, so relatively normal here, normal contour of the bone, normal density of the bone. The calcaneal inclination angle here a little low, so you're thinking there may be a little bit of some overpronation and collapsing of the mid-tarsal arch, which we can see here where the arch is falling. Another example of needing some orthotic support, but has not advanced to forming a large spur. So a final summary of X-rays. Of course, we're going to look for the bone spur and explain the bone spur to the patient, or exostosis. Is there no bone spur? Does it say, this hasn't been happening for very long, or maybe we need to look at different diagnosis? Or is it a huge spur that says the patient may have been overweight, a runner, or just really overpronates and having that fascia pull for a very long time on the spur on the bottom? Again, the spur is not what's painful, but it does give an idea of how much traction, pressure, pulling the fascia has had over time. We're going to look at the mid-tarsal arch, how much it's collapsing, has a lot of correlation to how much stress is being put on the plantar fascia and correlates a lot with how much the overpronation is present. So we're looking at a little bit of a biomechanical exam by looking at the x-ray, of course, corresponding to the patient's own foot type as well. Also, of course, looking for fractures in the spur itself, looking for fractures in the calcaneus itself or other areas. Subtalar coalition to indicate foot type. Also bone density, an obvious bone tumor, other things like that. And always getting an overall look at the soft tissue. Can you see some soft tissue density, soft tissue calcifications, some arterial calcifications? Get a thorough look at the whole foot on the x-ray, but of course address the all-important bone spur, which most lay people will come in thinking that's their diagnosis.